7s, and I'm a PN student at Wilson State College. And today I'll be showing how to administer two types of insulin. One's going to be an insulin pen, and then one's going to be two types of insulin together. So before I can go in my patient's room or anything, I'll need to compare my provider's orders with my MAR. So I'm going to do my demo dose NPH insulin U100. Okay, so sorry. First, I'm going to check meds. That is my patient. So I have Shirley Koss, date of birth 4/3/1987. So perfect. She's a 33-year-old female. Perfect. She came in. She does have an allergy with codeine, so I'll have to make sure that none of my medications listed have any codeine. So I've got my demo dose of NPH insulin U100. So 15 units subcutaneously with dinner. So I'll have to make sure dinner is provided, but we administer before. Okay, so and that's at 17:30. So right now it's 17:10, so I'm still within the 30 minutes before and after. So perfect. And then next I'm gonna do my regular insulin U100, so that matches out perfect. 10 units subcutaneously, BID, so twice a day. So that is gonna be all right because that's also at 17:30. And then next we're gonna move on to my Lispro U100 insulin pen. Okay, so that is also at 17:30, and I've made sure that my CNA has gotten my patient's blood glucose and that her blood sugar was 178, and that was just about 5 minutes ago, so still within good time. So now that I've checked that and this all matches out, I'm double checking Shirley Koss, 4/3/1987. That is good. So I'm good. So, oh, whoopsie, wrong one. Sorry. And then I'm also going to be showing the camera. Okay. Okay. So, sorry about that. Okay, so now that I have this, I'm just going to pretend that these were in my med bin, and this was all in my med bin. So I would verify that the patient's name matches the med bin, and I'm in the med room, and I'm going to perform hand hygiene, and then I'm going to put on my gloves. Okay, so I have my gloves on, and I performed hand hygiene. So right now I'm just going to be going through all my meds. So we have my NPH U100 insulin, and I'm just rolling this because it's supposed to be cloudy and sometimes it gets diluted. So U100 NPH, perfect. 15 units subcutaneously with dinner, perfect. At 17:30, and then I'm going to be looking on here, Shirley Koss. Okay, perfect. 4/3/1987, that matches, perfect. And the expiration date on this is 2024, so that is good. Next, we're going to be moving on to my regular. So I've got my regular U100, 10 units subcutaneously twice a day. And so 1700, so perfect, that matches. And then Shirley Koss, 4/3/1987, so that matches, so that's perfect. And then I've got my Lispro U100 insulin pen. So I've checked my pen, the expiration date is 2064, and then these two are 2024, so they're both good. And then so Shirley Koss, 4/3/1987, perfect. And then we've got U100, perfect. And we're going to be doing 2 units of insulin because her blood glucose was 178 from my mild sliding scale. So that's good. And then I'm just going to be checking my equipment. That is not expired or anything. Perfect. And then this is an insulin syringe, so I've got my correct equipment. And then this expires in 2022, so that is also good. So perfect. Now that I've done that, now I can move on to prepping my medication. So I'm going to take my caps off. Wiping the tops of them for 10 to 15 seconds. And then 10 to 15 seconds. Perfect. So actually, before I can withdraw any medication, I'm gonna need to put air in. There we go. Okay. So I know that for my NPH, I'm gonna withdraw 15, and for my regular, I'm gonna do 10. So I'm gonna start with my NPH. I'm gonna take off my lid, and then let me just get this where I can see. There we go. And so then I'm gonna withdraw 15. So we've got 15. Here, wait. There we go. 15. So I've got 15 for my NPH. And then I'm gonna be putting that in. And then I'm gonna be taking this out. And then I'm gonna be withdrawing 10. There we go. So I've got my 10 for my air, and then I've got put in my regular and make sure I'm above the line so I'm not getting any water, and then put it down. And then I'm gonna be holding this up, and then for my regular, I know that I'm going to be getting 10 units. So there we go. I got 10 units, and I'm just gonna tap this air bubble out. Still making sure I don't bend my needle or anything. Let me just try flicking it. There we go. Okay, perfect. So now I have my 10. Will you verify that that is my 10?
Yes.
Okay, perfect. So now I have my 10. So I'm able to withdraw that. Perfect. There's no air bubbles, so I'm good. So now I'm going to be administering into my NPH. Oh, sorry, what did that happen? Oh my gosh, sorry. There we go. Now we're in. Okay. And we're going to be holding it like this. And then we're going to be withdrawing to 25. Can you verify that's 25?
Yep, that's 25.
Perfect. So then we're going to be taking out. And then I'm going to be doing my one-handed scoop method. Perfect. And then that is my 25 with no air bubbles.
Yeah.
Okay, perfect. And then we're just going to be writing on this NPH, and then that was 15, and then my regular 10, and then my initials, and then the time, which is still 15, 20, so we're still within that time, and the date. Okay, so once we have that, then I can put that off. Put this on here. Perfect. And then I'll put these in here because I'll still scan in the patient's room. And then next we're going to be moving on, and I'm just going to be double checking my Lispro pen. So 2064 Perfect Shirley Cass, 4 of 3 of 1987, so perfect. And then we're just going to be checking there's no discoloration, no cracks, okay. And then perfect, and then that is good. So I'm going to be cleaning my top. So we're going to be doing this, and my pen is good. And then I'm going to be grabbing this, rechecking my expiration dates. So that is good. And then I'm going to be twisting this on. And then I'm good. And then I'm going to be keeping this, throwing it away. And then I'm going to prime my needle just so make sure all the medication gets into my patient when I do administer my insulin. So I'm just going to have you guys watch with me. So right now I'm at 2 units. So I'm just going to press up. So 1, 2, 3. Okay, so perfect. So we saw it, so it's good. So now I can recap. And then even though they have their name and everything, I'm just going to still put an extra label on here. Perfect, with my date, time, and initials. So now that I have that, I won't be covering the patient's name. So now I'll be heading into my patient's room. I'll be degloving and I'll be performing hand hygiene. So then once I'm in my patient's room, I'm currently, hi Shirley, my name is Morgan. I'm going to be your student nurse today, okay? Then I'd be performing hand hygiene and regloving, but for this purpose, I'll just have the same gloves on. Okay, Shirley, so how are you doing? You're doing all right? Okay. I'm just going to verify your name and date of birth. Okay, so what is it? Shirley Cost. Perfect. And then 4/3 of 1987. I'm just going to double check. Perfect. So that checks out. And then it says we have an allergy to codeine. Is that correct? Yes, it is. Okay. So I just want to let you know, Shirley, that these don't have any codeine. And what I'm going to be administering today, it will be 2 in a syringe. 1 is regular insulin and NPH. So the onset for that is about 60 to 90 minutes. And then for this one is about 15 minutes. So that will be good because you'll be having your dinner right away. So is your dinner something you're going to want to eat today? Okay. So I'm probably going to stay with you after I inject your insulin just to make sure that everything is eaten and then you've got something in your tummy to eat. Okay. So sounds good. So do you do insulin injections at home? You do. Okay, I'm sorry. I'm just going to make sure. So I've rotated this and I've made sure it's at least 2 inches away from the umbilicus. So I'll pretend that I moved this and it's in a different area where you did not have your last injection. So I'm just going to be doing my next check. So I'll be taking this. So demo dose, insulin, U100, 10 units, and then NPH, 15 units, so I know that's 25, and then that's for 1730, so it's perfect. It is 1730 currently for Shirley Cost. Okay, perfect date of birth, 4/3 of 1980, subcutaneously, so that is good. So Shirley, I'm just going to be trying to cover you as much as possible, but I'm going to be cleaning off your skin first. So I'm going to be going from inside to outer. Let me just grab that piece right there. There we go. Okay. So now, Shirley, I'm going to count down with you. And you usually do it in your abdomen, correct? Okay. And then this wasn't your previous spot, correct? Nope. Okay. And then while I'm here, I'm going to scan my patient's wristband and then scan their medication. So I got boop, boop. Okay, perfect. And now I'll be taking my label off so it doesn't conflict with me. Okay, there we go. Okay, perfect. We've got our 25. So, Shirley, I'll let that dry. So I'm just going to be going in at a 90-degree angle, okay? So I'm going to be taking off my top. And then I'm just going to be administering. Okay, ready? 1, 2, 3. So we're going to be slowly pushing the medication down. Very slowly so it doesn't burn or anything. I'm going to be holding that there just for a couple seconds. Are you still doing okay? Okay, perfect. And then put my safety on, then my sharps. And then in real life, I would make sure no medication came out and my patient's doing okay. So Shirley, we're just gonna pretend for this demo that I moved that to over here. So I'm gonna check my pen, but first I'm gonna re-swab. Okay, sounds good. So Shirley, I'm gonna check my pen. Lispro U100, mild sliding, so I am gonna do 2 units. So I'm just gonna verify that this is 2 units. Yep. Okay, perfect. So now I can administer, so I'm just double checking. Expiration date, 2064, Shirley cost 4/3 of 1987. Perfect. So now I'm gonna be taking off my label so it's not in the way. And I've let Shirley's stomach dry. So now I'm going to be coming over to this side just so I can get a better angle at this. Are you still doing good, Shirley? Okay. So now I'm going to be taking off my top. And now I'm going to go down at a 90-degree angle. Okay, ready, Shirley? So I'm going to be waiting for that. And then I'm going to be pushing, holding for 15 to 20 seconds. Okay, perfect. And then I'm going to release. And then I see that I have my red, so that's my safety. And then I'm going to twist my needle. There we go. Put it in my sharks. Perfect. And then I'm going to make sure my patient's doing okay. And come over here. Put the top on, and then I'm going to be throwing any garbage away. And now Shirley is okay to eat her meals. So, Shirley, are you still doing okay? Okay, sounds good. So, I'm just going to sit with you and make sure that you get something in your stomach. I'm going to make sure your collar's right here. I'm going to bring your bed farther up if you'd like it. I know you liked it in this position. So, I'm just going to be documenting everything. I'm going to be signaturing, and I'm going to be performing hand hygiene when I leave the room. Do you have any questions? No? Okay. Thank you.